We're going to go up to Capitol Hill. Joining us there, another lawmaker will go across the aisle. Congressman Sean Casten, Democrat of Illinois, member of the Financial Services Committee, with us this morning. Congressman, you heard from Don Bacon, the congressman from Nebraska, Republican. He's optimistic that something can get passed, a compromise, to deal with these expiring ACA enhanced tax credits. Would you agree before December 31st?
Well, first off, it's a pleasure to be here. It's a pleasure to be on after my friend Don Bacon, and I'm sorry he's retiring. We're going to miss him around here. I don't think I share his optimism, unfortunately. We know that the path to get through, I would agree with him that the path to get through requires 60 votes in the Senate. To get 60 votes in the Senate, you're either going to have, something like the extension of the subsidies that just failed, or on the Republican side, there's just a lot of push to put a lot of poison pills, not provide women with, access to full maternal health care services, and then you're going to lose Dems and not get the 60 votes. It's unfortunately true that we got all of the benefits of the ACA on a straight party line vote when the Democrats controlled the Senate. We got the extensions of the ACA subsidies that gave 20 million more Americans access to health insurance during COVID on a straight party line vote. And I guess what makes me sad is, to the point of one of your last callers with Mr. Bacon, is that the ACA is a Republican idea. It came out of the Heritage Foundation and was adopted by Mitt Romney, and was a really good idea. And when Obama came in and said, let's take this good idea that was created in the Republican Party and let's make this a national idea, all of a sudden it then became a partisan idea, but it's still a good idea, right? We still need to find some way to address the healthcare needs of folks who don't have private health insurance from their employer, aren't old enough to qualify for Medicare, aren't veterans, so don't qualify for the VA, aren't Native Americans, so don't qualify for the Indian Health Care Service, aren't poor enough to qualify for Medicaid. That's a big gap of people that the ACA was designed to fill in. And every time we cut people out of that program, we cut huge chunks of people out of dignity, out of the ability to have a healthy life, and it drives up the overall cost of our healthcare system. So I'd love to be optimistic, but I really have a hard time seeing the Senate or the House getting to consensus on what's sort of blindingly obvious and should be bipartisan.
All eyes turn to the House next week. Speaker Mike Johnson this week saying there will be a vote on a health care proposal. If moderate Republicans are able to secure a vote on these compromises that have been put forth by the likes of Congressman Brian Fitzpatrick and Congresswoman Jen Kiggans, who have teamed up with Democrats, if he allows a vote on their proposals that folks are trying to get a discharge petition on, do you think they could pass in the House? Would Democrats support one of these proposals?
Well, look, I'm all for Mike Johnson bringing votes to the floor. Let's not have these conversations in back rooms. I'm not sure I have something intelligent to add beyond what I said a moment ago. It really, the devil's in the details. If you have a clean extension of the ACA, and look, if they're concerned, if they think there's tweaks they want to make, okay, fine, but do a clean extension for 1, 2, 3 years. Give time to have that policy conversation. I think the idea that we're going to make major structural reforms to the ACA with everybody having time to think through what those are, whether that means adjusted payments, blocking out access to certain people who are currently eligible for the ACA, the idea that we're going to do that in 7 days and really think through the details, I'm not sure I buy that. So I think if there's a vote for a clean temporary extension, I think that probably could pass, could certainly get all Democratic support. The more it's constrained, the less optimistic I am that has the votes in the House.
One of the proposals by the Problem Solver Caucus Chair Josh Gottheimer, along with Jen Kiggans, a Republican, 1-year extension, income limits, and fraud protection. So close to what you're talking about here for extending these enhanced tax credits. What have you heard from your leader, Hakeem Jeffries, in the House about what leadership is thinking the next move is for Democrats?
I have not spoken directly to Hakeem or other leadership about that question. I do just think there's a general question. I mean, if you start saying we're going to put fraud protections in, income limits, for who? How is that done? We saw in the big ugly bill that the Republicans passed earlier this year, we saw things that said they were putting in fraud protection for Medicaid. What that did practically is made it really hard for people who are struggling, maybe can't access the necessary paperwork, maybe need social service support to fill out those forms. Those people just fell out of the healthcare system. I'm not saying fraud protection is a bad thing to do, but I'm just saying the devil is in the details. And I think everybody in the Democratic Party from leadership on down is keen about not making major structural to our healthcare system without enough time to really think through those. So just personally, I think we are better off with just a clean short-term extension and then get to trying to tweak this if we think there's appropriate and a good consensus to do so, but not try to do that between now and December 31st.
All right.